took this out of a patient on Thursday. What is it? It's no use looking for the label. It's not marmalade. You tell us. It can't be that difficult. For heaven's sake, you're a second-year student. You must have seen one of these before.
Well, yes. I was once offered something rather like this in a restaurant in Crete. Naturally, I sent it back and had the moussaka instead.
Shut up. What is it?
Could it be a very shriveled kidney?
Excellent. It is indeed a scarred and grossly contracted kidney. A shriveled kidney is a shriveled kidney, whether it's due to chronic pyelonephritis or being left too long over a hot charcoal grill.
Why exactly did you take the kidney out?
For the same reason you sent yours back. No use to anybody.
Ah, that's a surgeon's point of view. But the professor of medicine, Professor Avery, was saying only the other day that he seriously doubted the value of removing a diseased kidney in this condition.
Well, of course he did. He can't do it. He's a physician. Besides, 2 kidneys are a luxury.
Then why do you suppose we have them?
For precisely this contingency. Do you realize that a man can survive perfectly well without half his liver, 2/3 of his brain, 3/4 of his lungs, and his entire colon, tonsils, adenoids, appendix, spleen, and gallbladder?
Not much of a life, though, is it, sir?
Don't moralize, Waring. This is a teaching session.
No, sir. I've got the kidney biopsy we needed.
We wanted to see how the other kidney was getting on. What's a biopsy? Tell him, Waring.
Well, it's a way of looking inside somebody without actually cutting them open. We use a long, thin needle, you see, and we get a sliver of the kidney. Would you like to look? Here we are.
What does it show?
Crud, actually.
Crud? Could you be more specific?
Unidentifiable cellular debris.
Let me see. Good heavens, Waring, this isn't kidney, it's pancreas.
Oh. Sorry, I probably missed.
Missed? Mackenzie, what are you doing on the surgical ward?
It's about the student, sir. Professor Avery is waiting on the medical ward.
That's all you can do on a medical ward. Dr. Mackenzie here is a physician. Either his patients get better, in which case there was nothing wrong with them in the first place, or else they get worse, in which case they end up over here, needing surgery.
I think that is a bigoted opinion, sir.
And you can tell Avery I said so, if you can get a word in edgeways. Run along, all of you. Back at 2:30 sharp. Waring, about that biopsy.
Oh, yes, I'm sorry.
Sorry. Being a surgeon means never having to say you're sorry.
Oh, sorry. No, not sorry, not sorry.
Be gods.
Be good. I'm sorry I got up this morning. So sorry I worked with Professor Loftus. Sorry I'm a surgeon. Hello. Yes, all right, I'm coming. Sorry, I'm Duncan Waring.
I'm not. I was looking for you. Duncan, how do you fancy a 3-week holiday for 2 in the Bahamas?
With you? Forget it.
No. With Kate. Or Nurse Willett, if you like. Think about it.
What are you getting out of it?
Oh, I'll just settle for the Aston Martin.
Eh?
Yeah, it's the first and second prizes in this competition. It's all on the back of this wrapper. So if you're interested, maybe we could get together.
No, I got some work to do, mate.
Okay.
Yeah, there you are, Duncan. Now, what took you so long?
Dick did. Where's the gallstone, then?
There is a gallstone involved, but it is growing inside a patient. Never forget that.
I didn't think it was grown inside a greenhouse. Where is it?
It's in his gallbladder.
Where is the patient?
That's better. Now, it may only seem a very small point, but a patient isn't just a lump of meat to be carved up.
Oh.
He's a butcher, as a matter of fact.
Oh, we should get on like a house on fire, shouldn't we?
Ah, Mr. Wilkes, this is Dr. Waring, your surgeon. I am sorry he kept you so long.
Well, just sharpening my knives, eh? Anyway, Mr. Wilkes, I understand you've got a gallstone. Has it been giving you much trouble?
Trouble? Nah. I didn't even know I had one. Doctor sent me in for heartburn.
It's perfectly true, actually. It was discovered on a routine X-ray. He is completely asymptomatic.
Oh. What's that mean?
Well, what that means is that we doctors can see it, but that you patients can't feel it.
Yeah, not so much of the we and you business. Just have a look at it. See it on here?
Yeah, there.
That? That could be anything. You sure there wasn't a fly on the lens?
Mr. Wilkes, when I want some bacon sliced, I shall most certainly come to you. In the meantime, I must ask you to put your life in our hands.
Blimey. I can't be that bad.
Oh, look, it's a small operation. Just relax, eh?
Operation? Look. Can't you just give me some tablets or something?
No, the best thing is just to whip it out here and now.
Well, Duncan, not everybody would agree with you. You see, Mr. Wilkes, your condition is at the centre of a fascinating medical controversy, a sort of demarcation dispute, if that's the word, between physicians and surgeons. Gallstones, gallstones, gallstones. Do we, don't we? Do we, don't we? Do we, don't we? Cut them out.
Yes, we do.
Well, now there you are, you see. That's the surgeon's point of view. But if you were to ask a physician on the other... Oh, our very man, Dr. Mackenzie.
What do you want? I'm very busy.
Well, Mr. Wilkes is a little bit worried about his gallstone. He wants to know whether he really needs an operation.
Oh, certainly not. Anyone knows that.
Oh, charming. He couldn't wait to get stuck in, that one. I heard him say he was sharpening his knives before he come down here.
Naturally, he's a surgeon. Us physicians, on the other hand, take a very different line with gallstones.
Oh, yes, stand and wait till it's too late.
Giles Avery, Professor of Medicine, says letting a surgeon anywhere near a gallstone is like letting a thief near the crown jewels.
Do what you like, then.
I certainly am.
Yeah, no,
Hang on a minute. Someone's got to admit him.
Yes. Can't you just give me a prescription? I'll get back to the shop.
I'm afraid it's not that simple. You'll have to stay in for a few days for observation and stabilisation.
A few days, but I'm a butcher. Who's going to look after the meat?
Oh, don't worry. We'll get Dr. Waring to pop down and see to it. Aye, well,
Vitafizz? You've been having a booze up with the chaplain?
Blasted thing won't come off. I have to soak it off. Hang on.
Oh, get out. You're completely obsessed.
I'm not obsessed, I'm just realistic. For a professional gambler like me, winning these competitions is a cinch.
Oh, like your horse in the National that fell in the paddock.
Eh? Yeah. Well, I've got a system. All I need is 50 of these labels to cover every conceivable combination. All you've got to do is lend me £10 to buy some more bottles.
No chance.
You stand to lose an awful lot, you know.
Yeah, I know, £10.
Well, look after this lot and I'll have a look round the dustbins.
well, if you're that hungry, I'll buy you a bag of crisps.
Andy, let me get you a drink, eh?
No, stay where you are. I'll get this
No,
one.
no, please, it's the least I can do after losing my temper this morning.
It was my fault for poo-pooing your treatment.
Cheers.
2 whiskies, small ones.
Oh, blimey. What's all this lot, then? Mackenzie's Instant Guide to Rapid Diagnosis?
No, it's the file on Mr. Fuller, Professor Avery's prize patient. Thanks. We don't know what's wrong with him, but we know everything else. Avery's fanatical about gathering information. Even a simple case of gastroenteritis is treated like a murder investigation. Cheers.
Add to what Avery's right behind you, mate. Looks as though he's about to make an arrest.
Who did it? Was it you, Mackenzie? My ophthalmoscope. Somebody's been using it.
Well, what makes you say that, sir?
Well, the battery's flat, and I put a new one in yesterday morning.
Well, maybe you left it on overnight.
If I were that careless, I would not now be Professor of Medicine.
You put the batteries in upside down, sir.
Well, those notes, Mackenzie, when I last saw them, they were in a pink folder.
They were in a pink folder, sir, but it burst.
Oh, I see. Well, are you sure you picked up all the pages? It seems incomplete.
Oh, it is. You haven't got the diagnosis yet.
It is irresponsible to make a diagnosis without assembling all the evidence. That's just the sort of thing you surgeons do. Well, Mackenzie, who do I have to see this afternoon?
Well, sir, you exhausted most of the patients this morning, and everybody else. There is, however, an asymptomatic gallstone, a Mr. Wilkes.
Really? Oh, I didn't know about that.
Yeah, Dr. Waring didn't know what to do with him, so he referred him to us.
Well, how extraordinary. Waring, my dear fellow. Loftus, come over here a minute.
Don't shout at me, you excitable little man.
Let me congratulate you on your enlightened registrar.
Why, what's he done?
He's just referred me an asymptomatic gallstone.
You have done what?
Yes, Mr. Wilkes is a lucky man. He will be the first one to try my new drug. The drug that will make your gallstone surgery obsolete within 3 years. Come along, Mackenzie, we've got some work to do.
Waring, have you forgotten every single surgical principle you were ever taught?
I'm sorry, sir. No, I'm not sorry. A surgeon is never sorry.
Wrong, Waring. I know one surgeon who's going to be very, very sorry if that patient isn't on the surgical ward this afternoon. Yes, you, sir.
Oh, Duncan, I've got some...
Good day.
What?
Out of my way.
You did that on purpose, I saw that.
Look, Dick, will you forget about those for a moment?
Don't be ridiculous, this could be worth a fortune.
Look, I'll lend you that £10 on one condition.
Look, if it's about that Aston Martin, it's no go. I need that car. I'll do anything to get it.
Oh, no. I just wanted to do a little job for me, you know, something that requires a little tact, charm, sincerity. A little bit of amateur dramatics.
Not so much of the amateur, old boy. My Ophelia was the talk of Gordonston. Good afternoon, Mr. Wilkes.
Good afternoon.
Are they looking after you?
No complaints?
Yeah, I should think not, by Jove. I'm Professor Avery, you know. He's a wonderful fellow. I go to him myself.
But you're a doctor.
Yes, well, doctors get ill, you know, and when they do, they know who to go to. And if it's a gallstone, Avery's your man.
You've got a gallstone too.
Oh, I've had one for years. Yes, never bothered to have it out. The surgeons have tried to get me to have it out, but I always say no.
What's the matter?
Just a little twinge I get now and again, you know. Still, it's better than having the operation. Oh, get me to a chair.
Yeah.
Glass of water. Thank you. Cheers. Oh! It's burning! Get Dr. Waring!
It's his gallstone, Doctor. He was just talking about it and...
That's the way it goes. If he'd had the operation earlier, he would have been perfectly safe. As it is, touch and go. And probably the gallstone has lacerated his stomach. Hello, get me the operating theatre. Make it quick. It's an emergency. I think we're going to need about 10 pints of blood. Oh. Make it 15. Oh. 20, quickly. It's all right. Oh. He's very young, comparatively young. He may pull through.
Oh! Oh!
Hey, how soon can you fit me in? I'm on the operation.
Surgery this way.
All over very quickly, wasn't it?
Well, it was an emergency.
Here. Show us your scar.
Certainly not.
Oh, go on.
There's nothing to see. Oh, I mean, well, there's a dressing on it. Mustn't come off. Don't worry. Feeling much better now, Doctor, and I'd like a little stroll up the corridor and out.
Don't forget, we've just undergone a major operation. Now, Mr. Wilkes, I wonder if you'd mind just signing this consent form, please.
What for?
Well, it just means that you'll undergo the operation at your own free will.
Oh, yeah. Get it over with, eh?
Mm-hmm.
I don't want to be dragged out screaming.
Aha! So here's where you've stashed Mr. Wilkes. Hello, Mr. Wilkes. See, you got a dead one over there, eh?
Just a little groggy from the effects of anaesthetic. Mackenzie, Mr. Wilkes is on my ward.
Now, just a minute,
and he
Duncan.
has signed the consent form. He is going on tomorrow morning's operation list. I'm about to ring Loftus now.
Fine.
Fine.
Good.
Good.
As far as I'm concerned, the matter is...
Closed.
Right.
I think I fell asleep. I think I'll just read my paper.
Hello, Mr. Wilkes.
It's you again. What's the matter this time?
Oh, nothing. Nothing at all. No. You know, Mr. Wilkes, it really doesn't matter what treatment you have so long as you believe in it. And when you wake up tomorrow morning, if you wake up tomorrow morning, and most of them do, they'll have ripped out your entire gallbladder, so you can be perfectly certain that that teeny-weeny gallstone has been ripped out with it.
That's all right. You can live without a gallbladder.
Yes, you can live without one. But, Mr. Wilkes, have you ever stopped to wonder if the Almighty, in his infinite wisdom, fashioned the human body in all its wondrous complexity as a training ground for surgeons? I mean, after all, it's a bit like the army holding tank practice in the Garden of Eden.
I don't care what they do to me. I'm going to be asleep.
Yes, yes. With any luck, you will be. But, it has to be said, some of our anaesthetists are remarkably inefficient.
Absolute nonsense. You know nothing at all about anaesthetics.
He's just had a very serious operation.
Huh?
He perforated his gallbladder and Dr. Waring had to whip it out.
He did a very good job of it, and I think I'll just go right now.
You've just had a major operation. I think we'd better give you an enema. Followed by a blood transfusion.
He's already had 20 pints.
Not of blood, I can assure you. Dick, you come back here. Well, he has gone. Fancy that.
But that blood was stone me. He was having me on.
I'm afraid so.
Who was he?
Your anaesthetist for tomorrow's operation. Come, Mr. Wilkes. It's wonderful to have you back in the medical ward. If you just like to hop into that bed there, I'm sure you'll find it to your comfort. There you go. Duck you up.
So, what happens now?
Well, we'll start you on the tablets as soon as possible. You take 3 a day and they just dissolve your gallstones away.
Ah, yeah. Like biological washing powder.
Precisely, yes, just like.
I want that man.
He's mine.
He signed a consent form.
He's changed his mind. Hello, Mackenzie here.
Patient here you ought to see.
Very here.
Patient here you ought to see.
I'll be right over.
I'm coming.
Where are you going?
What's it to you?
None of your business.
Excuse me, is this Mr. Wilkes' room?
No.
Yes.
Seems to be some disagreement.
No. Yes.
Well, is this Mr. Wilkes?
Yeah.
Ah, Mr. Wilkes, Professor Avery has asked me to take a decent history if the doctors have finished with
Well,
you.
I hope they have, because they're driving me potty.
Now look what you've done. Casualty.
Oi, where's the surgical patient?
Where's the medical patient?
In there?
What, 2 of them?
No, just one, a middle-aged housewife. She's brought in unconscious and nobody seems to quite know why.
Well, couldn't you find out for yourself?
I like that. From what I hear, you two have been pulling Mr. Wilkes around like a pair of hounds over an old slipper. Besides, it doesn't seem to matter what I think anymore. So I thought I'd let the pair of you fight it out amongst yourselves. Excuse me.
Come on then, I'll sort it out.
Not until I found out what's wrong with her.
Look! Hairy Scottish pillock. That woman is unconscious. And if I can wake her up, she might tell us.
Look before you touch.
Take your hands off me. I have had enough. I am going to ring Loftus, mate, and he will sort you out.
You ring Loftus, I'll ring Avery.
Right.
Right.
Give me Loftus, quick.
Thank you, Mr. Wilkes. You've been most helpful.
Look, when are they going to get started on these tablets?
Oh, you mean the Professor's new drug?
Yeah, new drug?
Yes. You're terribly lucky. It's been tested on rats, and the Ministry have just decided it's safe to try it on human beings.
With all due respect to the Ministry and you, Professor, they can stuff it.
Mr. Wilkes, I think you fail to realise
Hey? Excuse me, am I interrupting?
It's all right, she's just going.
I'm sorry, you'll have to talk to the Professor about it. It has nothing to do with me.
Upper class bag.
About that little bit of play acting this afternoon. Now, you won't tell anyone, will you?
I've decided I'm going to have the operation. If I'm going to go, I'll go as a man and not as a guinea pig. Can you help me get back to the surgical ward?
Yes, I'm going there now. Yes. There we are.
Thanks, mate. Here! Where are you going with that?
This is no good to you. Full of sodium and potassium.
Yeah, but I want the label off that. I fancy 3 weeks in the Bahamas.
Well, I fancy that Aston Martin. Look, why don't we get together? Look, when you get to this label here at the back, I like Vitafizz because my mind goes a complete blank.
Ah, you ain't thought about it, have you?
I have.
Listen, have you ever had Vitafizz?
Well, I've had to drink
It's
it.
marvellous. It's the fizz with the whiz, get it?
Can you see right through to the other side?
Of
course not, sir.
Well, can we assume that she has a brain?
Well, yes, sir.
Then she's a lot brighter than you two. Get out of the way. Waring, get out.
I'm sorry, sir. She's a surgical patient and I'm not leaving.
Are you aware that I am the professor of medicine?
Yes, he told me this morning.
Pertinent puppy. Well, I will examine the eyes, Mackenzie. Oh, blast this.
Have mine, sir.
Where did you get this? A toy shop?
Duncan, I pulled it off.
I told you would sooner or later.
It's going to cost you something. It's going to cost you something, but we'll talk about that later. I persuaded Wilkes to have the operation.
You're behaving like a pair of excited footballers. Stop it. Waring, where's the woman patient?
Oh, she's in there, sir.
Good.
With Professor Avery.
What? Avery, I understood that this was a surgical case.
Without even seeing it. Typical.
She's coming round.
This isn't my bedroom.
No, this is the casualty department at St. Swithin's Hospital.
Have I had an accident? Well, at least my teeth are in, thank goodness.
Your husband couldn't rouse you this morning.
Well, I was asleep. He shouldn't have been trying.
But you've been asleep all day.
Oh, that'd be the extra sleeping tablets I took.
Why did you do that, you silly woman?
Well, it was Reggie's chest. It was just like trying to sleep with an accordion.
Gascoigne, deal with it. Waring, we'll go and see Mr. Wilkes.
What are you talking about, Loftus? Mackenzie, we'll get started on Mr. Wilkes' treatment right away.
You'll have a job with taking out his gallbladder tomorrow morning, isn't that so, Waring?
Yes, sir.
Mackenzie,
Don't worry, sir. We've got Mr. Wilkes on the medical ward.
are you suggesting that my registrar is lying?
Let's say he was misinformed. Come along, Waring.
Come along, Mackenzie.
You're gonna look very silly, Duncan.
Oh, well, let's wait and see, shall we? I might even buy you a drink. Who loves you, baby?
Where is he?
I tell you, sir, he was here a half an hour ago.
Yes, I can vouch for that, sir.
Shut up, Clark. Well, he's gone now, and I have a pretty good idea where.
All right, Loftus, where is he?
You know perfectly well.
He's not on my ward.
Clark, have you got something to do with this?
Quite frankly, sir, the matter has gone completely out of my hands now.
Ye gods, was it ever in them? Waring, this is preposterous.
Mackenzie, this is disgraceful.
Mr. Wilkes, it seems you have some very important visitors.
Gascoigne, what have you been doing to him? He looks ill.
He pumped me full of fluid and shoved me under the X-ray. Yes, I am ill.
I like to follow up all of my patients, so I came to see Mr. Wilkes, and I found that nobody had given him a cholecystogram. The very first thing I would have done.
Waring?
Mackenzie.
So when we look at the X-ray, this looks very much like a gallstone. But when we come to the cholecystogram, we find there's no gallstone present.
First one was a gas shadow.
Oh, it's a very obvious gas shadow.
Does this mean I haven't got a gallstone at all?
That's right. You must be jolly chuffed about that.
Chuffed! After all I've been through, I hope when you kids get to be doctors, you're going to turn out better than this lot. I reckon if you gave them a week-old stiff, they'd spend another week arguing whether it was alive or dead. Well, I'm off.
Oh, before you go, why do I like Vitafix?
Oh, get
That's
Shut up, all of you. The teaching session is cancelled. You can all go. Well, Avery,
Well, naturally, I'd never have treated him before I'd seen the cholecystogram.
and I'd certainly never take out a gallbladder without seeing it. Of course, if you're registrar...
What about your registrar?
Quite, both our registrars.
Yes, you can't get good registrars these days.
Oh, no, wait a minute. We didn't have the patient for a long enough time.
We didn't really have him at all, sir. There wasn't time.
Time, you can always make time if something's got to be done. What about a round of golf this weekend?
Oh, what a good idea. What's your health again?
9.
Oh, really?
Hey, what happened to all that medical-surgical rivalry stuff, then?
No. The big knobs always stick together in the end. They're a real pain in the neck.
Where's me Vitafizz? I've got one thing to say to you. You need some bleeding sense knocking into you.